This video is all about mobility for golfers. We're going to go over some of the screening tools that you can use at home and we use clinically, as well as some strength testing and a little bit of balance as well. The first thing we're going to talk about is some of the balance tests. Some of the things we do in clinic involve a 2-foot stance with your heels and toes together and the hands on the hips. Also, a one-legged stance where you're lifting up one leg, as well as a tandem stance where you have your heel and toes in a straight line as if you're walking a line. With all of these balance tests, we're going to test this with eyes closed. May make it a little bit more challenging. An important test for golfers is a simple toe touch exercise. Can you bend forwards and touch your toes? And if you can't, then there's a little bit of a trick involving bending one knee or the other to see if it's asymmetrical. Maybe we have more tightness on one side versus the other. One of the strength tests we want to do is a hip bridge. This can be done on 2 legs as well as just the right or just the left. When we do a one-legged test or a unilateral test, we're looking to see if there's any asymmetries. Is one leg stronger or weaker, or maybe it's more balanced. A specific test that we do for golfers is looking at the rotation of our hips as well as our shoulders. And when we test this, we want to try and do this in isolation. That means looking only at the hips and then only at the shoulders. When we're looking at the hip rotation, we want to try and keep the upper body totally still, whether using a club or maybe a broom to keep the upper body still so you have a visual cue that it's not moving, while we're trying to rotate our hips left and right. Again, when you're doing this, we're looking to see if we have full range of motion or we feel any tightness or any pain. When we're testing the shoulder rotation, we're trying to keep our hips as still as possible while our shoulders are rotating all the way to the left and all the way to the right, or vice versa. Again, same concept as the hips. We want to make sure that we can rotate freely without any pain and discomfort, ideally at a full range of motion and even. Wrist range of motion is especially important for golfers. When we're talking about range of motion for the wrist, we're looking at the flexion, the extension, the radial deviation, as well as the ulnar deviation, and of course, supination and pronation. When we're looking at the head, more specifically the neck, we want to make sure that we have full rotation to the right as well as the left. This is important for the backswing, as well as at impact and the follow through. Try some of these movements at home and see if you feel even, balanced, strong, and of course, pain-free. If you do have any asymmetries, try to get yourself as close to even as you can, and then hopefully you can get out on the course and have the round of your life.